What's up, my friends? In this video, I simply want to walk you through how I've shifted from managing symptoms to really addressing the root cause of a lot of the issues that we see today in the 21st century. Right? The core of that shift has been this kind of breath-based, nervous system focused approach. Right? Breath work, simply put, is more or less responsible for making me a far better practitioner. It's made me a better dad. It's made me a healthier, stronger individual. And today I just want to highlight exactly how it all works. Now, when I say breathwork, I want to make something really clear. If you think breathwork involves a group of people hyperventilating, screaming, releasing trauma, this might not be the right place for you, right? But if you're a practitioner, you're kind of tired of managing symptoms and you want to learn how to work at the level of the nervous system, right? This root cause of health, then please keep watching, right? I've been a physio for 10 years now, and I, like most health practitioners, got into this field because I wanted to help people. But it didn't take long for me to realize and just feel like all I was doing was kind of kicking the can down the road. Yeah, what always came up for me was that Desmond Tutu quote, right? There comes a point where we need to stop just pulling people out of the river. We need to go upstream and find out why they're falling in, right? Healthcare today is failing. And it's not because we lack treatments, right? It's because we're addressing symptoms instead of supporting and creating health, right? The entire healthcare system, if you think about it, is built on top of symptoms, right? Someone has a set of symptoms which are then used to create or provide a diagnosis, right? You have these symptoms, which means now you have this diagnosis, this disorder, and then a treatment plan is created based on that diagnosis, right? Now you have this issue, this problem, here's how we're going to manage that. But this just really isn't how the body works, right? This is taking the outputs of a system, right? These symptoms, whether that's pain, fatigue, stress, flare ups, my immune system, right? And deciding that the treatment should be involved in suppressing or eliminating those symptoms. Symptoms are prompts, right? They're not punishments. Symptoms tell us that something is wrong, but they don't tell us what is wrong, right? Our job as a health practitioner is really not to suppress or override symptoms, but it's to support and restore function, right? And these are two really different objectives. The real question should not be like, what's the root cause of disease, which is what it seems a lot of practitioners are asking, but it should be, what is the root cause of health? Right? I walked away from traditional healthcare because I was tired of seeing the same cycle over and over and over, right? Symptoms, treat those symptoms, patients plateau, they get a little bit better, and then different symptoms flare up, right? Nothing really changes because all we're doing is slapping a band-aid on a problem, and we're not really addressing, why is this person expressing all of these different symptoms? And what I realized after a couple of years working in hospital settings, in community settings, right, was that I wasn't missing another tool. I tried that. I went and did all of this different professional development, trying to fill this hole in my own confidence, right? Of like, well, I don't really know how to treat that condition, right? This set of symptoms, right? I wasn't missing a tool. I was missing the system that was underneath all of these tools, right? That discovery really led me to dedicate my work over the last 6, 7 years to restoring health at the most fundamental level, right? So let's talk about what I shifted and why it actually works. I use breath, right, in this kind of breath first, nervous system focused approach. And the reason behind that is very, very simple. The nervous system is the operating system of the entire body, right? A dysfunction at the level of the nervous system can show up in any system downstream. It can show up as digestive issues. Someone could have IBS, right? It could show up as postural issues. Someone could have chronic pain. It could show up as mental health issues. They could experience anxiety. It could show up as energy issues. They could have chronic fatigue, right? The issue with the medical system is we take those different sets of symptoms and we give them these different diagnoses, and then we try and treat those individual problems. But what if the problem was actually upstream of the digestive, the musculoskeletal, right? It's coming from the level of the nervous system. So when we understand the nervous system being the kind of driver, right, of health or disease, And what is the driver of the nervous system? Right? Breath is one of the primary inputs to our nervous system. The way that we breathe 22 to 25,000 times every single day determines the state of my nervous system. Does my nervous system perceive that I am under threat and the world is dangerous? Does my nervous system perceive that I am safe? Right? That is going to more or less flip a switch in the body and determine where are we allocating resources. Are we allocating resources to survival? Adrenaline, cortisol, increase heart rate, divert blood flow to the limbs, right? So I can get away, the so-called fight or flight response. Or am I allocating resources to repair, recover, digest, restore, the so-called parasympathetic state? That here's the kicker. Doing breath work is not the same as correcting the breath, right? Most people are breathing dysfunctionally all day long, right? And that dysfunction is the hidden driver of much of the stress-based issues that we see today, right? Anxiety, chronic fatigue, chronic pain, immune flares, right? All of these things that are kind of heavily influenced by stress are heavily influenced by the way that we breathe, because stress and breathing cannot be separated, right? You can't just fix someone's breath by doing a breathwork session, right? When I kind of first started in this world of breathwork, that's what I offered, right? Breathwork sessions. But I realized I was again not addressing the root cause, right? If someone is breathing dysfunctionally due to their back pain or the chronic stress that they're under or early childhood trauma and they've got a nervous system stuck in a protective or defensive state, right? 30 minutes of breathwork ain't going to fix that. It might make them feel good in the moment, but it does nothing to address the root cause. And so we want to kind of consider, why are so many people breathing so poorly, right? We are sitting more than we ever have. We're spending more time on our phones than we have. We're more stressed than we've ever been. These things directly impact the way that we breathe. And the way that we breathe informs the nervous system, and the nervous system determines our level of health or disease, right? So it comes back to addressing the breath right at the front of the system, right? I'm not talking about breath work, I'm talking about breathing, right? Breath is not just this kind of like tool that we use. I'm going to breathe this way. It's a conversation, right? It is a real-time feedback loop between the body, the brain, and the environment, right? Breath is really the foundation our nervous system uses to determine whether or not we are safe, right? And safety is the prerequisite for healing. So if we really consider this, right, the nervous system being the kind of key determinant of health or dysfunction, breath becomes the kind of most direct way to access our nervous system, right? Breathwork's not really about breathwork. Breathwork is about the nervous system. It's about being able to communicate, right, with the nervous system and kind of change the inputs. Someone is breathing shallow up into their chest quickly all day long. It's very hard for anything else to override that, right? The nervous system is just getting this constant input that we're in danger, right? So it's going to, again, allocate all its resources to survival, action, and be reactive. Without changing the breath, right, we can't change that input. We can use all of the kind of cognitive behavioral tools, we can use frameworks, we can use thinking-based tools, movement, diet. All of these things are still working at the level of the nervous system. And so if the nervous system is dysregulated due to dysfunctional breathing, we're kind of walking an uphill battle here. What I began to see is that when we restore breath back to its optimal state, right, what happens is we're able to kind of shift the state of the nervous system. When we shift the state of the nervous system, everything changes, right? This domino effect where we change breathing and it begins to knock over all these other dominoes is because of the impact that it has on the nervous system. Now, this isn't about adding another protocol, right? It's about upgrading the system so that everything works a little bit better. And so most people kind of see breathwork as a method, right? I see it as a way of seeing, right? It's a lens that we can start to look through. It tells us about the state of someone's nervous system, and it also becomes a tool, a leverage point to influence the state of the nervous system. But again, I just want to highlight the difference between breath work, right? This corrective, or sorry, this experiential part of like, I'm going to breathe this way, and the restoration of breathing, right? The restoration of breathing needs to happen first because there is so much dysfunctional breathing because of 21st century, right? The stress, the stimulus, the notifications, the hustle culture, the expectations, the never ending to do list, like all of the stuff that we're just bombarded with on a daily basis shows up in our breathing. And our breathing goes on to inform our nervous system, right? We teach a kind of outcome based, assessment first form of breath work, right? First, we correct the dysfunction, we bring breathing back to its optimal state, and then that opens the door for all of the other change that is possible, right? This model that we teach through a kind of a methodology of biomechanics, physiology, nervous system, and emotions being these kind of core pillars. Once we bring those things back to their optimal state, now we can talk about breath work, which is this incredibly powerful tool, right? But it only works if we've built capacity in the system for change, right? If we've reestablished a healthy foundation. This is the kind of model that I've taught to over 200 health practitioners from a variety of different settings. And the reason that it works across all of these different settings is because when we stop focusing on the problem or the diagnosis, right, and we start focusing on the person, we can help a lot more people with a lot more things, right? If you are a practitioner and you're looking for this kind of root cause approach that's grounded in the science of the nervous system, that's exactly what this program delivers. That is exactly what I teach. Right? Below this video is a link where you can actually just jump onto a wait list. You'll be notified when we open spots, right? We only open spots every month, a couple of spots. And this practitioner program might be for you, right? Jump on the wait list. I'll send you some details, and I look forward to discussing this further with you.